am V. Saranya from Indian Academy of Optometry. So we are going to demonstrate the contact lens insertion, removal and the usage procedure. The patient is ready for the procedure and the prescription is here. The spherical power is -1 in the right eye and we are going to demonstrate in the right eye. The recommended lens for the procedure is the soft contact lenses. Required for the soft contact lens insertion are the base curve, power and the diameter. So now I am going to measure the corneal diameter required. So I will instruct the step-by-step procedure. So this is the IPD scale. So with the help of this and by shining the torch I will measure the HVID. So you should look at this lens. So the measured HVID is approximately 12 mm in the right eye. For the contact lens procedure, so we have measured the horizontal visible diameter of the patient. So approximately the patient's HVID is 12 mm. So as for soft contact lenses, the diameter should be 2 mm greater than the HVID. So the final diameter of the trial set would be 14 mm. For the power, so the prescription power is -1 diopter. So we are keeping the same power in the trial set. So after that, the final prescription or the final trial set format would be the base curve, the power and the diameter. So this is the required trial set for the patient and this is the format for the final prescription also. So we are ready with the trial set. So this is the trial contact lenses. This is the contact lens cleaning solution. So the retinoscope, the torch, the prescription. So the trial set is ready for the insertion. Before handling the lenses or before starting the procedures, we have to make sure that we have kept our hands clean. So we have to wash our hands with moisture-free soaps or any solutions and then pat them dry with a lint-free towel. This is the most important procedure which gains confidence among the patient and the practitioner. It also prevents the transmission of any infection. So now after washing, we have to pat our hands dry with a lint-free towel. So now we are ready to start the procedure. Now we are taking the trial lens out of the blister pack. We have to handle it carefully. Just take it out. Now we are going to perform the taco test. So after removing the lens from the lens vial, you have to place the lens on the thumb as represented and gently apply a pressure such that the lens bends into the shape of a taco as shown. In these cases, it is proved that the lens has not turned inside out, and while performing this test or while handling the lenses, your hands should be washed and kept clean and the fingernails should be trimmed and kept clean. These are the steps or the precautions which ensures that the procedure is a success fit and the patient gains confidence and a satisfaction. So this is another test to make sure that the lens is in the appropriate position. So after taking the lens out of the vial, place it on the dry forefinger and make sure that the lens is in the form of an even cup shape. This ensures that the lens is in the correct position and has not turned inside out. In this case, it is another image where the lens is in the form of a shallow shape and the edges have been pointed outwards. This shows that the lens has turned inside out. So these are the preliminary tests to make sure that the lens is in the correct position. So we have to clean it with a disinfection solution. So with the help of the forefinger, just rub the lens for about 5 to 10 seconds. After rubbing, take your lenses on the dry forefinger of your dominant hand. I'm going to insert the contact lens in the eye. So it's just a minimal procedure. You look straight ahead without turning your head or without looking in any of the directions. So with the lens in the forefinger of your dominant hand, just pull the upper lid with the thumb finger and with the middle finger of the same dominant hand, pull the lower lid and ask the patient to look down. So now the Now move your eyes this side to one side. Downwards, 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 downwards. Look down. Now look up. Close your eyes. So after this, we have to allow the lens to set in the eyes for about 5 to 10 seconds. Usually soft lens don't take much time for adaptation. So after this time, we have to ask the patient to gently open their eyes. Please open your eyes gently. And the contact lenses are well settled, and now we have to ask the patient how is their comfort. Are you feeling comfortable? Yes. Do you feel any itching or irritation feeling inside your eyes?
No, mind watering is there.
Mind watering is there. Okay. Now the vision is clear across the room?
Yes, I can see everything clearly.
Now the vision is clear, right? Okay, now the contact lens has settled and the patient is also feeling comfortable. So we have to further assess the fit and the following parameters will be assessed. Lens is adequately covered the cornea, and now we are going for the centration, and it's well centered over the cornea. Now we have to check for the movement. We have to ask the patient to look in all the cases. Up, down, straight position, to the right side, to the left side, up and down. Okay. So the movement is also as per the preferred steps. Now we are going for the push-up test. This is to determine whether the fitting is a loose fit, tight fit or an optimal fit. So we have to just ask the patient to look in a straight ahead position. We have to just push the lower lid upwards along with the lens. We have to do it carefully to make the patient feel comfortable. So we have to slowly release the down lid, and if the lens slides so quickly, it's a loose fit or a flat fit, and if the lens slides slowly, it is a tight or a steep fit, and if there is a normal movement and a recentering, it's actually an optimal fit. And as per the parameters, this fit is an optimal fit and the patient is feeling comfortable. So the assessments are correct and the fit has been success. So now we are going to do over refraction, which is the final step in the contact lens assessment. So we are noting the reflex in both the horizontal and the vertical meridians, and the reflex is a full glow in both the meridians. So there is no residual power left. So the reflex is full glow. Now we are assessing the contact lens fit. So first we are measuring the patient's comfort level. So the patient is well comfortable and they are satisfied with our fitting procedure. The corneal coverage is also adequate, that is 2 mm about, over the cornea. The centration, it is well centered in all the cases. The movement is also adequate in all the directions in all the 9 cases, and approximately it might be up to 0.5 mm. Now final, the push-up test, which reveals the fit status. The lens recoveries with optimal speed and it recenters with optimal speed on the cornea. So final is the over refraction after the trial set fitting. So the reflex is glow in both the meridians, so there is no residual astigmatism left, and this is the final prescription for the patient with the -1 power. The base curve is 8.4 and the diameter is 14 mm. Going to instruct the patient regarding the removal of the contact lenses. So after the insertion procedure, we have to make the patient comfortable, and by lifting the upper and the lower lid, we are asking the patient to look straight ahead and then to the nasal side, and with the forefinger we are gently moving the lens to the temporal side, and with the help of thumb and forefinger with the light pinch we have removed